We continue to have infrastructural challenges within the hospital. It is good that our HDU ICU unit is about to be completed. We have to struggle in terms of equipping it, but we are going to do it. This is a project that has been stalled for the last 10 years, but we are very, very happy that Her Excellency the Governor has put in resources to ensure that the people of Naivasha and of Nakuru in general can access better ICU and HDU capability. I think remains a serious challenge in Nakuru County. I believe it's the same across the counties of Kenya. But here in Nakuru we've had a challenge with years and years of not recruiting, replacing staff when they leave, of not promoting staff who are due for promotion, and not recruiting a fresh set of staff, in spite of the fact that we have been building hospitals across the county. So that is something that Her Excellency the Governor has admitted to. It is something that she has developed a strategy with us to ensure that progressively we recruit the staff that are required to manage and provide services to citizens. So in terms of maternal death, one of the things to note is maternal and perinatal death continues to be a challenge for Nakuru County. And there are a vast array of reasons as to why we continue to face a challenge with this issue. The second thing is to really have concerted conversations with the counties that surround us, because a high number of the maternal deaths that take place, especially in this hospital and at the Nakuru County Referral and Teaching Hospital, are also referrals, and some of them come very late. So we're also trying to address those gaps. The third gap is about the availability of ICU space. Here in this hospital we have only 2 ICU beds. In Nakuru we have 6. So when those ICU beds are full and a mother needs to be transferred from Margaret Kenyatta, I'm just giving an example, and the ICU beds are full, your hands are tied. All you can do is to contain and to manage the patient within the theatre. And this is exactly what happened with the death that took place, the unfortunate death that took place at the weekend. In the past, and as we have moved now to the social health insurance, we had the National Health Insurance Fund. All these hospitals, this one Naivasha, PGH, and all the other level 4 hospitals were owed high amounts of money by NHIF. And with the transition to SHA, we are still having the conversation about whether or not these debts will be paid. So when you look at money in and money out, and especially in terms of need, the gaps are glaring. In terms of the Facility Improvement Fund, I believe last year our performance was 1.4 billion, thereabouts. Keep in mind what I said about the amount of that money that is going to HR. So our performance in terms of on-source revenue is very good. And by the way, because we've automated, the sealing of the gaps and the loopholes in terms of revenue seepage has diminished substantively. In all our hospitals, there are no longer any cash transactions. Everything is required to be paid through one M-Pesa number. So we think that with all the measures that we have taken, this revenue is going to continue to rise. Last year, remember, we had a long-standing strike, doctor strike, and then we had other cadres of staff going on strike. So that also really diminished the performance on source revenue. So we are hoping that this year it will be better.
We are a hospital that attends to approximately between 1,000 to 1,200 patients, outpatients, and our inpatient is a 300-bed capacity and 50 cots. At the moment, the hospital is offering those services that are supposed to be offered to our patients amidst the challenges that we normally have. Of course, as an institution, the big numbers that we attend to on a daily basis gives us a challenge of having a bit of long turnaround times, especially in our outpatient. But that is because of the numbers. But the patients end up being given the services they demand from the facility. Ideally, these are level 4 hospital. We should have services like CT scans and other equipment that are required because we are in an accident-prone zone. So those are some of the services that this hospital requires, which we do not have in the facility. And I believe that the county government and the national government are trying to address that so that the patients that require those imaging services, they can have them. The level of facilities, we normally go with what we call the vein classification of supplies. That is the vital, essential, and non-essential. Vital supplies are there, essential supplies are there. The non-essential supplies, most of them we do not stock, because at the end of the day, these are supplies that patients and our clients can be advised to buy. But the vital items and the essential items, those ones we have them in the facility. The new wing, actually, you see, this is a project that was done in collaboration with the county government, KenGen, and the Ministry of Health. The Ministry of Health ideally was supposed to equip the building, and that is what we are still waiting on from the NEST program that the government has launched the other day. And we had a team that was there today that came to assess on our readiness to accept those equipment. And they have found that we are ready to accept those equipment. So probably in the next 1 or 2 months.
PGH, hawa wakulima mtu akishalima hivi, mtu apate bibi kwa sababu kuna chakula, alafu aende PGH aage dunia. Mama aende PGH aage dunia. Mtoto afariki apelekwe mochari apotee. Nafikiria there is a big problem with the PGH. Na mimi nauliza serikali ya Susan Kihika iangalie PGH, kwa sababu PGH ndio hospitali ambayo kubwa ambayo tunayo. Na hiyo PGH inasafu watu wa Narok, inasafu watu wa Nyandarua, inasafu watu wa Baringo huko. Kwa hivyo tunauliza governor angalie wale watu ambao wanasimamia PGH. Tulisema na nimesema PGH na health haitakikani kusimamiwa na mtu ambaye hajawahi kuwa kwa health. You cannot put a pedestrian asimamie mambo ya hospitali. You cannot put an amateur ati anasimamia mambo ya hospitali. And that's the problem. Wacha yule mtu ambaye anasimamia hospitali aweze kujua dawa wakati wali. Hii Nakuru hospitali in terms of health we were number 1. Right now we are last. So na ni kwa sababu ya hiyo ati watoto wamepotea, mama amefariki. Sasa huyo ni mama watatu kufariki akizaa. Ikiwa imefuatana. Naivasha tulikuwa na hiyo. Ati hata vyopo vingine hakuna. So hiyo tunasema hiyo serikali iangalie na iweke watu competent.
Ana dararia kire.
Za nini?
Sisi wa hela huko. Ndio sasa anachukua katalizi. Anachukua katalizi.
Unachukua nini?
Kata.
Take care. Take care.